So in video 1 we talked about background and overview of program logic models. This video is now around a bit more detail about how to build a program logic model. So this is the basic template that we showed in video 1 and went through it quite briefly, so I'm just going to go through some of these elements in more detail. So whether you're building your program logic model from left to right or right to left, always start with a problem statement. So this is really around the issue that you're trying to address, and the most important thing here is really around trying to make the statement informed either by a formal needs assessment or at the very least a discussion with stakeholders, maybe looking at the evidence to see what are the root causes of this issue, talking with clients or patients who are using your service. And then your objective is really your goal or your aim, and it's a useful anchor for the rest of the model. So inputs can be either tangible or non-tangible. So tangible things are obviously things like funding or staff. Non-tangible resources can include evidence from other studies, maybe clinical guidelines or frameworks that you might need to follow, relationships with stakeholders, and so on. And then outputs, as we've seen before, are the activities or services that you intend to deliver and the people that you deliver them to. I think the main thing to say here is with the activities, fill them in now, but when you come to do your outcomes, you might find that you need to come back and revisit the activities because they're not actually going to achieve the outcomes. And also around the participants, just be really specific here because that's going to help you tailor your program too. So for example, if you're designing a program for people who live in rural areas, or your population has a large proportion of people who are at work, you might need to tailor your program accordingly. So then the outcomes. So these are the changes that are intended to happen for your target group as a result of your intervention. So these are much more than just the number of people you reach or the number of sessions held. And we've already spoken about short-term, medium-term and long-term outcomes in video 1, but just a comment about long-term outcomes. You'll rarely see these outcomes during the life of your program, but I think it's just important to see if you try and demonstrate a causal chain or some sort of theory or evidence that indicates that actually if the short-term and medium-term outcomes are achieved, the long-term outcome is also realistic. And your outcomes themselves should be realistic, so changes that are likely to happen as a result of the intervention. Specific and measurable, they should be based on evidence, so there's research evidence to suggest that the activities will lead to the outcomes, and they should be relevant to the problem statement. When you're developing your outcomes, try and brainstorm with others. A useful tip is to use post-it notes. Just write down what sort of outcomes you might expect to see from your activities and then sort of arrange them in a hierarchy of short, medium and longer term outcomes. And you can also build your logic model, as we've said before, from left to right, which is the if-then approach, but you can build it from right to left, so that's the but-how approach. So with this one you might say with longer term outcomes are improved patient outcomes, but how are we going to achieve that? We're going to reduce avoidable presentations and so on. Assumptions are very important. They need to be clear and checked because they can prevent a program from achieving its intended outcomes. And they generally include beliefs about the program, such as how and why it will work, and also about the program participants, so how people will learn, how they behave, and their motivations. And they're the things or the conditions that need to be in place for the model to work. And they can be as simple as things like assuming that people will turn up to our program, the program will be accessible. To identify assumptions is actually good to brainstorm with others because they'll have different beliefs and experiences and knowledge about the problem and how to address it. And then external factors are anything really external, such as economic, political, cultural, that might influence your program and its outcomes. And if something isn't working in our program, knowing about the external factors might help us to understand why. So perhaps a new service just opened up nearby and everybody's going to that one. Again, with external factors, brainstorm with others, including people who know the local context and the environment. And the other thing about doing external factors is they'll allow you to put risk mitigation strategies into place. So there's the program logic model in full. So just some final tips. I'd include as many stakeholders as possible in your consultation, and brainstorming is a great activity for program logic models. Try not to build them by yourself. Keep it as a living document, so you'll often find that activities will need to change, or there's been changes in external factors, which means you need to modify your model. But doing that means that it is kept up to date and is something that's useful for the life of your program.